Is a tooth with lateral radiolucency cracked? So if you have that doubt, please come with me. I'm Dani Mancuso, specialist endodontist and prosthodontist, and I'm going to show it to you. As you can see in the x-ray of this upper left second premolar, you can see an apical radiolucency and also a lateral radiolucency in between the first premolar and second premolar, compromising the coronal third and mid-third of the root. Well, it could be few things. It could be cracked, it could be a periodontal lesion, or it could be something else. Do you know what it is? And as you can see here, that lateral radiolucency is related to a lateral canal. So when you have the toxins in the main canal, if you have a port of exit of that canal sideways, that is where you can expect to have radiolucency as well. So sometimes, depending on how advanced that is, you can even probe that area. You will feel that is a deep probing depth, but sometimes it's not related to any periodontal lesion or a crack. It's just because of a lateral canal. So make sure you expect that in your cases, and only if you disinfect that area properly that you are going to see the sealer going in that direction. So if you block that lateral canal when you are preparing because you are not irrigating, you are not flushing that canal enough, then you are going to block it and the sealer will not go in that direction. That means that that radiolucency will never heal, will never disappear. This is a similar case now with the upper left first molar. As you can see here, there is just one defective, quite narrow root filling. What do you expect on a molar? At least 3 canals. But sometimes you can have just 2 canals, or sometimes you have just 1 canal, or even more, you have 6 canals. But you need to expect a bit more when that canal is not completely centered in the root. And when you see some lines across that looks like cracks, but they are just the border of the root. Check the difference now. Interestingly, this tooth only had 2 large canals. However, that front canal, the buccal one, had a ramification sideways, and in this case there was a deep periodontal pocket, but the patient doesn't have any problem in terms of periodontal disease. So why that tooth? Could it be a crack? Yes, it could be. With the magnification you will be able to see if it's a crack on the mesial ridge or under the mesial filling, so you will be able to see it. But in this case there was no crack whatsoever. It was just related to the necrosis of that main canal with the port of exit sideways going in that direction. I think sometimes we complicate things, we overthink, and sometimes it's easier than that. My advice to you is, if we couldn't find any more reasons why, like the patient doesn't have any periodontal disease, generally speaking, and you cannot see many cracks in other teeth and occlusion seems fine, so think about the easiest thing that could be, which is just infection, just the necrosis, and just the lateral canal ramifications, isthmus, and things like that. So I hope you can now achieve more success during your root canal treatments and extracting less teeth. Thank you very much.